Good morning. I'm Ed Shore at the Lucille Packard Foundation for Children's Health, and I'm pleased to welcome you to today's webinar on measuring family experience of care integration to improve care delivery. In addition to the foundation, this webinar is being sponsored by the Catalyst Center and National Family Voices. For reference, a background paper related to the instrument we're going to be discussing was referenced in your webinar invitation, and a blog related to it is on the Foundation website. We have two speakers today. We will be beginning with Hannah Rosenberg, who is the project manager in the Integrated Care Program at Boston Children's Hospital. She was instrumental in the development and implementation of the PICS, the measurement tool we'll be discussing today, and is also involved in the development and implementation of a care coordination curriculum to enhance the skills of care coordinators. Following Hannah Rosenberg, Dr. Rebecca Baum, who is the Division Chief of Developmental and Behavioral Pediatrics at Nationwide Children's Hospital and an Associate Professor of Pediatrics at The Ohio State University, will be discussing her experience with measuring implementation of measurement of integration. Prior to her role as a division chief, Dr. Baum served as Associate Medical Director for Partners for Kids, which is an accountable care organization affiliated with Nationwide Children's Hospital. For those who will be interested, this webinar is being recorded and will be available sometime after it's completed. In addition, the slides of the speakers will also be made available. So let me ask Dr. Hannah Rosenberg to begin. Hannah?
Thanks so much, Ed, and thank you for having me speak on the webinar today. I'm really excited to bring the Pediatric Integrated Care Survey to this audience and talk a little about the background and development of the tool and reference how it is being utilized today. And then I will be turning it over to Dr. Baum, who will be talking about how they are implementing the PICS tool at Nationwide Children. So we are excited to bring to this audience kind of that a trajectory of how the tool is actually being implemented right now. So I'm going to spend the next few minutes doing a little bit of framing. So next slide, please. So as Ed said, the Pediatric Integrated Care Survey is a measurement tool meant to assess care integration. And the way we describe care integration is the seamless provision of healthcare services across the care continuum from the perspective of the family. So the measurement comes from measuring family experiences. We relate all of the measures that we collect within our program and that we promote across the center with triple aim outcomes. And so the PICS instrument falls into primarily the patient and family experience outcomes. So it's improving the experience of patients and families, but also, of course, touches on ultimately improving outcomes and reducing costs. By identifying where there are currently gaps in the system and gaps in integration. And we really talk about the intention of collecting patient and family experience measures and creating that partnership with families is the key objective is being able to identify gaps currently in care and care coordination service provision. And actually being able to use the data that is collected by the instrument to inform quality improvement and intervention work. And we'll, throughout the next few minutes, I'll talk a little about that piece of the process. So we really focus here on not just the implementation and collection of these measures, but how these measures can be used to inform changes. Next slide, please. So the Pediatric Integrated Care Survey was developed, our team was out here at Boston Children's Hospital, but the development of the survey was funded by Lucille Packard Foundation for Children's Health. And the tool was not was not developed solely with research participants here in the Boston area. We did have people contributing to the development of the tool out in California, and we also had many participants who were from across the country, so it is not a region-specific tool. In the process of developing the tool, we included family input as the key informant along the way. So we started actually the development of the tool by holding focus groups with families to determine what elements, what care integration meant to them, what elements were crucial. We conducted several interviews with families, key informant interviews, and then we piloted a 95-question survey for about a 12-month period. And the results of that was we were able to validate 19 experience rating questions. So these were questions that asked the family to report on their experiences across the care continuum in the past year with regards to care integration. We have currently a core PICS instrument, and that includes the 19 experience questions. That also includes a set of healthcare status, utilization, and demographic questions. And then in addition to that core instrument, we currently have supplementary and topic-specific modules. These were questions we were not able to validate in the initial pilot, but we are currently using them and testing them, and we hope to eventually be able to include them in our validated set. And the PICS tool is currently available in English and Spanish. Next slide, please. So this framework is really what we based the question development on. This framework came from the families that we worked with in the development of the survey. And so integrated care is at the top and goes down to three kind of major domains, which is team-based care, connection to medical care and others, so community, school-based services, and then future and care planning. This framework is included in the publication that Ed referenced at the beginning as well. And when you look through our tool, you can kind of see how all of the questions and all of the concepts link back to this framework. Next slide, please. So we don't have enough time on this webinar to go into depth about the questions included in the tool, but I did want to give a flavor for some of the types of measures that we have. So we really focused in the development of the tool of creating actionable measures. So creating a measure that would be able to inform an intervention. We make a distinction between satisfaction and experience measures. So we don't ask the family how much they liked the care that they received or how happy they were with it, but we asked them about the functions of care integration that were developed as part of this project. So some examples are, how often did your child's care team members explain things in a way you could understand? How often did they know about the advice from your child's other care team members, follow through with responsibilities, explain accountability and responsibility, and treat you as a full partner? And as you see, this question asks, the framing of the question asks about members across the child's care team. So in the core instrument, we ask families to define for us who is on their child's care team from their perspective and then report across. But I will mention that we do have methodology in place to be able to work with individual clinics or individual organizations or groups to scale down that scope. So for example, if a primary care clinic is administering the survey, we have a methodology that we can provide technical assistance to individual groups where we are saying in the past 12 months, how often have your child's care team members in this particular clinic done X, Y, and Z. Next slide, please. So PICS is currently being implemented in several different organizations and types of organizations across the country. It can be adapted to reflect experiences of different populations. So medical, of course, behavioral needs. We had a strong focus on getting experiences of families with children who had behavioral health care needs in the development of the survey, social determinants of health, risk factors. It's currently being deployed in several primary care clinics, community-based, and specialty clinics, so it's not just from the primary care setting. For state, community, and family partner organizations have utilized it and are utilizing the tool. And as I said, programs with a specific focus on behavioral health integration. I will kind of reiterate that PICS results, we work with clinics who are implementing it to both collect these measures and then help to use the measures to inform, to set informed priorities for intervention. So PICS is intended to be an instrument to drive and to inform these changes and also to be able to measure over time. Next slide, please. So with this short amount of time, I did want to give a brief overview. And kind of just suggestions for getting started is we always recommend to start small. So to start with a small population and choose a target area to be able to prioritize measure selection. And I do want to note before I turn this over to Dr. Baum that we can help. We are here to be able to offer technical assistance with the administration of PICS. So PICS is available in the public domain. If you email me, I will send you the question sets, and I can also provide tailored technical assistance to help your institution, your organization be able to best use the tool to achieve objectives. So thank you so much, and I will now turn it over to Dr. Baum.
Thank you, Hannah, and I'm excited about the opportunity to share this program with you today. You can go to the next slide. This program is something that we are implementing at our hospital, Nationwide Children's Hospital here in Columbus, Ohio, and we've entitled it Navigate My Care. And the Navigate My Care program specifically has two goals. One is to reduce avoidable care, and then the other is to do that in a way that either maintains or ideally actually improves the family and patient's experience across our healthcare system, which can often be somewhat difficult for families to navigate. One thing I want to make very clear about this project and this program is that we have used our successes and challenges as an institution in designing Navigate My Care, but we very much wanted to base it on family feedback. That was incredibly important to us. Next slide. So we started the project by developing a series of focus groups, and we really wanted to hear from families affected by various types of complex health conditions. How are we doing? How are things going for you within our healthcare system? And I've included some quotes from families on this slide, and also wanted to highlight that the feedback we received from families, when we really distilled it down, fell into four main areas. You can see those in this circle here. So communication, challenges regarding transitions and integration, problems with monitoring, follow-up, and response, and then also families really wanting more support regarding self-management and activation. And so I think the quotes here are fairly illustrative, and they were, it was incredibly important feedback for us to get. So the providers aren't talking to each other. I was never told about support groups, and you can read some of the other quotes on your own. And as Hannah mentioned, these slides will be available after the webinar. Next slide. In order to implement this project, we did need to have a population of measurement. And so we created an algorithm that we call our Global Care Coordination algorithm that is based upon charges, visits, and specialty clinic utilization. And we were able to stratify our population into essentially 4 levels of complexity. And what we call our Navigate My Care cohort are patients who end up landing in levels 3 and level 4 on this pyramid based on the algorithm that I described. Next slide. So this is obviously a busy slide, but I wanted to highlight for you that this is a quality improvement project. And so we have a specific aim, which is on the left-hand side, and then you'll see the key drivers that were developed based on the family feedback, so communication, transitions, and integrated care. the other two I mentioned. And then we have implemented a number of different projects and interventions, and I'll be mentioning two of them, one of which is the PICS tool. On the left-hand side, on the specific aim, the first several bullets really refer to that avoidable care. So things like ED visits, inpatient admissions, readmissions, hospital days. And then the last bullet is that family experience piece. So we wanted to do all of these things, measuring it in our cohort population, but also be improving the patient experience along the way. Next slide. So the two interventions that I wanted to highlight for you, there are several, but these are the two that we really feel are key to the success of the program. So at Nationwide Children's, we feel very strongly that organizational-wide access to care coordination is a goal for our hospital. We have to do that, however, in a way that we can support financially, and we also have recognized from previous programs that we can't expand too quickly without an important infrastructure in place. So we are using what we call Plan, Do, Study, Act cycles, or PDA cycles, to roll out care coordination across our hospital system, and we are aiming for full integration and implementation of the program, hopefully within the next year or so. Next slide. As I mentioned, family experience is important for us to be measuring. And so we, after looking at the literature, actually chose the PICS tool that Hannah described. And the way we are using the PICS, we chose 19 of the core questions. There are some demographic questions included that we can get from our electronic medical record. And then we also chose 6 supplementary questions. And interestingly, all of the questions on the PICS and the supplementary questions mapped just beautifully to the key drivers that families told us were important to them for our project. We then developed a sampling strategy where we'll be sampling a quarter of our patients in the cohort each quarter. And our marketing department is helping to mail that out so that it's very clear that this is a Nationwide Children's Hospital program. And what's exciting for us is that our first set of letters to families went out about 2 weeks ago. And we've actually, I checked yesterday, we've had 4 responses so far. So we'll be looking at those responses over the course of the next few months, and as Hannah mentioned, really using this information to inform the development of our program. Next slide. The other piece that is, I think, incredibly exciting for us and for our hospital, we have a strategic plan at Nationwide Children's, and this has actually been published in Pediatrics. So we look at 5 key pillars. You'll see keep us well, do not harm me, heal me, cure me, treat me with respect, and then also navigate my care. And as our hospital has just gone through the planning process for our next 5 years, the one additional piece that we've added, actually new for this new iteration of the strategic plan, is interprofessional communication. And I think that's one thing that really the PICS taps into so nicely, is how are the different clinics, the different specialties, primary care, the community, how are all of those groups communicating with each other? That's going to be important to our strategic plan, and we'll actually be able to measure that going forward. Next slide. So those were all of the remarks that I had, and I believe we can open things up to questions, so I'll hand it back over to Ed.
Thank you, Rebecca. People are free to put questions into the question box on their screen. We have a few to begin with. Both are initially for Hannah, but we'll have others. Hannah, there were some questions about how the PICS was validated, how the questions were selected. I assume that's in the paper, the details of that, but anything you want to say about the validation process and how that was carried out?
Yes, and so I'm thinking that this is 2 different questions, how the questions are validated and then selected. So the questions in the core instrument they're not any different than the other questions, other than that they were able to be statistically validated to show that we were measuring what we were intending to. And all of kind of that, the methodology is within the paper. So if there are kind of specific, more specific questions about, you know, what metrics we use to validate them or kind of the process, either I'd be happy to kind of field those offline or refer people to the paper.
Terrific. Hannah, I'm going to pose this to you first, but I think Rebecca probably has some experience with it as well. One of the questions was, can you compare the family experience of coordination care instrument from Rita Mangione-Smith and her group with the PICS, how they complement each other or how they're different?
Yeah, absolutely. And she is a you know, colleague of our group, and we really, you know, think that the SECC is a wonderful tool as well. So the PICS tool, it is a measure of care integration in which care coordination is a component, but not the entire, not what we say kind of is the entire thing. So coordination we refer to as the set of activities, and integration is the perspective. And, you know, in this tool, it's the perspective of the families that across the continuum, there is, or across the different services, across different departments and institutions in which families are receiving care, there is continuity. So it is kind of that domain. The PICS instrument is not tied to a particular clinic or a particular visit, which is also kind of how it varies. So PICS asks about experiences over the past 12 months instead of anchoring to the last visit or, you know, the last time you saw your primary care provider. So that is another way in which the instrument differs.
Great. Rebecca, you must have looked at the other instrument as well. How did you consider
Right.
them?
And actually, we looked at a few different instruments, and one thing that I'll add that was unique for us about the PICS was that, as Hannah mentioned, it asked about the family's experience. So many of the questions include, how did you feel about, or how often did, as opposed to some other tools that we looked at that were really more all or none. So you either had a care plan or you didn't have a care plan. But we were really interested in some of those nuances about, well, maybe you have a care plan, but you're just really not all that excited about it or engaged with it, or so that experience, that feeling piece was really important to us.
And I'll just, this is Hannah again, I'll just kind of build off of what Rebecca said. So when we were in kind of the development of this, that is exactly kind of reflects, I'm, you know, so glad that Rebecca called that out, because we really, with some of these questions that asked about, you know, how often are your child's care team members talking to each other, and how much do they know about the advice that you got from your other child's care team members? We really, you know, some people asked, you know, well, how do they know if that's happening? And our really rationale for that is if the parents don't know that that's happening, then that's the same thing as it not happening, because they should be involved partners in their child's care and have a clear understanding that, you know, when they're going in for a visit or when they're talking to one of their child care team members, they should be able to understand how that care team member, how that service relates to all of the other services or all of the other providers who are working with their child. So that kind of, that perspective was very key in the development of our question set.
Thank you. We had referenced the paper that about the PICS that's been published, but for those of you who've deleted your webinar invitation, this was published with the lead author being Zinil, Z-I-N-I-E-L, in Pediatrics in 2006, volume 138, number 6. So that was in December of 2006.
And sorry, Ed, that was 2016.
16, I'm sorry, missing that. For those who have asked, the slides will be available from the foundation after this is used. We have some questions about Rebecca, about the survey that you've done, and how did you go about thinking about it? Is it what's the cost of doing the survey? Any other advice about using the PICS as a mailed survey to people?
So I think it sounds like the questions are regarding the actual logistics of the survey. And you know, as Hannah mentioned, their center provides technical assistance, and so we really started with conversations with Hannah and her group to ask about their experience with the survey. They've actually done some really sophisticated things that we didn't have the budget to do for our project, so we're going by good old-fashioned mailing letters and crossing our fingers that people return them. And interestingly enough, we've gotten a decent number of responses in a pretty short time. If in fact our response rate is lower than we've hoped, then we will try some more sophisticated things. But as of right now, we're really just mailing the survey out with a nice cover letter, I think, explaining why it's so important for us to get this feedback from families. One of the, I think, really fantastic things about our program is that it's organizational wide. But one of the things Hannah had mentioned was that if in fact the child's provider can mail out the survey and ask that it be returned and completed, that the response rate is often much higher. Unfortunately, we weren't able to do that, but I think Hannah's team was really incredibly helpful in allowing us to think through budget, but then also some logistical options. And Hannah, I don't know if you want to say anything additional.
Yeah, well, thank you so much and that's really, you know, what we try to do. And I will just say that, you know, that's absolutely right. We really want people to be able to use this tool with the resources that they have to help them achieve their objectives. So we are very happy to have conversations to try to work with groups to say, how can you take, you know, if you don't have, you know, resources for a huge project, if you don't have the ability to reach a broad audience, but you really want to start somewhere with it, we really have developed, and, you know, just by trial and error and by our work in the space, have developed several kind of models for groups to start out with and then tailor to make it work for them. And we're, you know, that's what our center is for. So I think Ed said this at the beginning, but we have our center, the National Center for Care Coordination Technical Assistance. We partner with National Center for Medical Home Implementation and are funded by Maternal and Child Health Bureau to provide assistance to any group who's interested in working with these tools. And we can, you know, help give an introduction, onboard you, and get you started with using these. So please don't feel that, you know, that you need this huge quality improvement budget, or you need, you know, an entire team of people. We really will help you focus in on using and implementing family experience measures with the resources that you have.
So one more question before we run out of time, and I also want to assure the people who are listening that we will ask the speakers to answer questions that were unanswered on the webinar and send those out by email to people. Hannah, besides Nationwide Children's Hospital, which is a pretty sophisticated operation, what other kind of places have been using the PICS? You know, and are they Title V agencies, other health plans? Who else has been showing interest in this?
Yeah, absolutely. So we do have, you know, several, you know, larger institutions who are, as Rebecca said, kind of doing more broad implementations. But we do have a lot of community-based pediatric practices who don't, you know, have the kind of the resources of a larger institution, but want to engage their families in this sort of way. That are enriching the tool. We also are partnering with, you know, some state programs, Title V programs, as you said, Ed, some family professional partnership groups, some, you know, state family voices chapters So we really, across the board, this shouldn't be thought of as a tool that has to sit in a medical silo, but we want it to be used in, the behavioral, community, school-based settings as well.
Terrific. Well, I want to thank Hannah Rosenberg and Dr. Rebecca Baum for participating today. This abbreviated time frame for webinar is an experiment on our part. We wanted to be respectful of people's time and attention span, and so if you have feedback on this 30-minute webinar model, we would love to get it. Your screen now shows where this information on this website this webinar is going to be available, and you've seen the contact information for Dr. Baum and Hannah Rosenberg. So if you'd like additional information, they are both open to being contacted directly. So thank you all very much for participating.